Hello, my friends, and welcome to another episode of Diverse Thinking, Different Learning. Today, we are tackling a topic that not only affects children and adolescents, but also their entire families. We're talking about chronic pain. And joining me today to help us better understand chronic pain is Dr. Samantha Levy. Dr. Levy is a clinical psychologist with extensive experience in working with children, adolescents, and families dealing with chronic pain. Her work is centered on empowering parents and children to make meaningful changes, reintegrating children into the world, and addressing family dynamics to expedite the healing process. Please join me in welcoming Dr. Levy to the podcast.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Dr. Levy, welcome.
Thank you. Excited to be here.
Thank you so much for joining me. I have wanted to talk about chronic pain on the podcast for some time because it does impact all aspects of a person's life. And as a result, you get associated difficulties with education, social functioning, emotional challenges. So when I heard about you and your work, I was eager to speak with you. So thank you again for agreeing to have this conversation with me.
Absolutely. I'm glad you're addressing this because you're right. It is a very important conversation and affects many more youth than people realize.
Yes. And I mean, chronic pain in young people is complex. It's multifaceted. Maybe we can start by just explaining the difference between chronic pain and acute pain. Let's start there.
Sure. So acute pain is really our warning system that was developed to protect us. So a child touches a hot stove, the pain on their finger tells them to take their hand away, and so they don't burn themselves further. So it's helping us. So in acute pain, the pain signals are going from the injured area of the body to the brain and tell us that it hurts. So we break our leg or we get the flu, and that causes short-term harm. So we treat it, we rest, we get medications, we immobilize with a cast if we need to, and it heals. In chronic pain, after the injury or illness has actually healed, the pain or the symptoms remain. So now the pain signals are what we call centrally mediated, meaning they're originating from the nervous system, not from the part of the body that's feeling the pain. So the nervous system is now sending signals that there's harm from that area, even though the injury has resolved. So we say that the nerves have become sensitized, and now the signals are all confused and they're activated. So the healed area can still hurt. So in pain, chronic pain circles, we say that hurt does not equal harm. So just because something hurts doesn't mean it's harm. So a really extreme example that everybody knows is phantom pain, phantom limb syndrome, where you don't even have the limb anymore and it's still hurting. So one thing that's really important, because a lot of people blame people for, with chronic pain for faking it, is that the pain is still real. It's just that the nerve signals are now firing without the need to warn us. We don't have, like in acute pain, we have this fire alarm going off saying, get out of your house because it's on fire. In chronic pain, it's like having a broken alarm system that's always going off, even when there's no fire. This can be really scary and stressful because we never know then whether it's a real fire alarm or a fake false alarm. And so these signals cause anxiety and fear, which then amplify the nerve signaling and exacerbate the pain signals. So just becomes a chronic cycle and a vicious cycle. And the longer these pain pathways have been firing for, the deeper these neural grooves, become, and the longer it takes to unlearn them.
Right. And what you've described is a lot about the science of pain, right? Because we're processing pain in our brain, which means that chronic pain is a neurological condition. And it's interesting because you said that, some people don't understand, if the injury is no longer causing pain, then how is this person still what, people will say complaining about pain that they shouldn't be experiencing, So that's where the complexity and the multifaceted aspect of chronic pain comes in.
Right, because it's one of those invisible illnesses. And in fact, chronic pain is now recognized as its own illness because it does create changes in the brain. So a lot of times people, especially kids who go to the doctor and they're told, "Oh, this is all in your head," they feel so demoralized and so accused, and they feel like no one understands that they really are in pain.
Right. And are there common causes of chronic pain in children and adolescents? Like, are there specific conditions that you see or triggers that you frequently see?
Sure. So we like to look at it all in what we call the biopsychosocial model. So that helps us look at the whole child and not just at one little piece. So by bio, we're looking at the biological factors, maybe predisposition, genetics, puberty. And if you want to ask me about why this often happens at the beginning of puberty, we can go back to that afterwards. And then there's the psychological factors. So that would be anything internal, stressors. Let's say the person has a mental health issue like anxiety or OCD that's stressing their system because they haven't been treated, or they're neurodivergent and undiagnosed. Maybe they're autistic, or they have ADHD, or they have dyslexia. And this is causing a lot of stress socially, in school, in their whole life, because they don't know what's going on or how to deal with it. Maybe there's gender dysphoria. Maybe there's undiagnosed learning differences. So anything that's an internal stressor makes it more likely for acute pain to then become chronic. And then the social part of biopsychosocial is anything outside of the person. So maybe they have difficulty with friends. Maybe they've had been victim of bullying, which is very common in kids with chronic pain. Maybe they have school issues based on all those things I said, before about they have dyslexia or something. Very often, the family of kids with chronic pain tend to be very, very, very nice parents. That's what we find a lot. But they're accidentally reinforcing the pain by really putting a lot of focus on it and coddling with chronic pain. So we can talk about that. But so there's sometimes secondary gain from it. Sometimes expectations from family that's very stressful can be a stressor, or family issues such as marital problems. And so all of these things cause isolation, basically. And the more isolated the child becomes a feedback loop, because the more isolated, the more pain. So all of those stressors under the biopsychosocial model, and I mean, there's a lot more than what I named, but those are the main factors, can make it more likely that pain goes from acute to chronic.
Okay. And what happens during puberty? You mentioned that.
Yeah, we find that it's really common for kids to come in at 6th grade, 7th grade, 9th grade. Those are kind of really common times, sometimes 5th because now people are going through puberty earlier. Some of the factors, I mean, obviously there's hormonal factors. So that's the bio part of biopsychosocial. Some of these mental health things like depression or anxiety or OCD are really kind of blossoming around that age, putting a lot of stressors on. And then let's say that the child is autistic and really high functioning autistic, and so people haven't understood that about them. Once you hit puberty, it's harder to mask. It's a lot easier when you're a younger child to kind of mask. But when you get into middle school and it becomes really socially complex, it can be very stressful if you don't understand what's happening. I had a client who said that being in middle school, he said, felt like he was watching a sports event that no one told him the rules to. So you have that. And then on top of it, you get to middle school and the executive functioning demands are so much more increased. And then again in high school. So now you're having to organize and plan and go to different classrooms and keep up with all this different homework. So if kids have ADHD or other executive functioning problems, all of a sudden it's much harder. And then the last big one I would say is we can talk about the common characteristics of kids with chronic pain, but one of the characteristics is that they tend to be the really well-behaved good children. Quote, I'm putting good in quotes. And this is the time, around puberty, you're supposed to individuate from your parents and start to kind of rebel, right? But they're the good child, so they're not rebelling. So everything is becoming internalized. They're stuffing inside the things that they would really normally act out on. And so that's also one of the characteristics of kids with chronic pain.
Yeah. Are there other common characteristics? It sounds like an underlying theme is that there's that suppressed stress, that internalized stress, feelings of overwhelm, maybe not meeting demands that are placed on them. Talk about some of the other common characteristics of students with chronic pain.
Yeah. So it's funny because when I meet with parents, I'll say, I know your children are, of course, individuals and they're all really different and they all have, their own things. But I'm going to list a few things and I just want you to nod if that's your kid. And the parents are just like nodding their heads and, their mouths are there. How did you know my kid? I'm like, well, because most kids with chronic pain have similar characteristics. So they tend to be perfectionists, which is a stressor. They tend to be people pleasers. They are very sensitive. So this can come in a lot of ways, but it can be sensory sensitivity, but it can usually be emotional sensitivity. Like they're the kids who are soaking in the emotion around them. So if parents are not getting along, those are the kids who are feeling it, whereas a sibling might be la la la, I'm not even noticing that mom and dad have tension. But the kid with chronic pain is the one who is really walking into a room and noticing the emotion in the room or in another person. So I already mentioned that they tend to be well behaved and they tend to have difficulty with conflict. And then there's that difficulty expressing negative emotions. So you touched on that. They may be angry, but they're not going to express it. And so where is that anger going to go? It has to go somewhere. So it gets shoved inside. And so they tend to be internalizers, meaning they have OCD or anxiety or depression. They don't typically act out. And then they tend to be the kids who worry a lot. If I say like, has your kid always been a worrier or had fears? That's very common. And then less common, but probably more than in the general population, we see kids who are neurodivergent or have learning disability differences. And sometimes they often will have a parent with medical issues or chronic pain. The last one I would say is that these kids tend to be kind of above average in intelligence. And we think it's because the smarter the brain is and the more creative the brain is, the more the brain is making connections and looking for like these warning signals and looking at associations. And so they're making these associations like, let's say they ate a bite of a plum. Let's say they had a plum and then they get a stomach ache. So they might have gotten a stomach ache anyway. They probably would have gotten a stomach ache anyway, but the brain goes, plum, stomach ache, plums are bad. And so then it's like, then their smart brain goes, well, red foods are bad. Okay, so now I can't eat strawberries or tomatoes or plums or watermelon because they're all red. So, and then that narrows what they can eat, and then it becomes more stressful. So Dr. Lonnie Zeltzer, who's a pediatrician who specializes in chronic pain, calls this the sticky neural loop, where it just becomes a vicious cycle. It's like a feedback loop. And because the smarter the brain is, the more they're making these unfortunate connections. She calls it the smart brain pain syndrome. And she actually and Georgia Weston wrote a book called The Smart Brain Pain Syndrome, where they really explain how that works.
Right. And it seems that when you have chronic pain as a young person, it sounds like it can lead to some of these avoidant behaviors that you're describing. It can, we're going to talk about isolation, and just the experience of being in pain can significantly impact their daily lives, impact educational, social, emotional, create those challenges. What are some of those challenges? What might that look like to a teacher in the classroom or a parent at home?
Right. So, you're right. It impacts every facet of life. When you're in pain, when the kids are in pain, and we're using pain broadly, by the way, here, but it can also be like nausea or stomach aches. It doesn't have to be exactly pain, like in the way that you're thinking, like your arm hurts. Um, so it impacts school, right? So they're not going to school most of the time. When they come to me, they're often not going to school, or they're going very sporadically. So school attendance, which obviously impacts school work. And then if you're not in school, you're not seeing friends. So you're isolated. Often they're not even up to seeing friends, even having friends come over. And then they get out of the loop in terms of like all the gossip and like all the drama. They get out of the loop. And so then they feel really weird going back to school because then they don't know what's going on. It affects after school activities. Like maybe they were a really good athlete. That's very common. Or, they used to do jujitsu or something, and now they don't go to that. So they've lost their identity. Their identity used to be, I'm a violinist or I'm a soccer player. And they lose that identity. And unfortunately, it makes it a lot easier to take on the identity of a sick kid, which we try to help them out of. It affects family life because the families can't go do things. They can't plan anything because they're going to go on an outing, but then the kid says they don't feel well enough. The siblings are upset because they can't go on the outings, or the child with pain is getting all the attention. Parents are stressed financially and emotionally over it, and then the child with pain feels guilty about that. It affects sleep. And then the problem with sleep is that when pain affects sleep, then they don't sleep, and then that makes more pain because lack of sleep causes pain. So it affects mental health problems. So often they come in with mental health problems like anxiety, but then the pain and the isolation and the not getting to school makes them more anxious because we're talking about perfectionistic, good, quote unquote, kids who want to do really well in school. These are the A students. These are the honor students who are freaking out because they're not on their path that they thought they were going to be on academically. And then the body gets weak. They're in bed. Their body gets weak. That causes all sorts of problems. And that can lead to other symptoms. And that's part of the problem, is that then we start getting to this kind of dysautonomia, these autonomic nervous system dysregulation symptoms like chronic fatigue and brain fog and POTS and dizziness and migraines. Because once they get, isolated and in bed, the whole physiological system, because the autonomic nervous system is controlling these involuntary physiological systems like breathing and heart rate and blood pressure, digestion. So when the system is stressed, all these functions can be affected. And then we have the feedback loop again of stress and symptoms. So it's like everything, it impacts every part of their life. And then it affects their body even more, like leading to more and more problems.
Yes. And you've described this loop that you talked about. There's this, and it's like a vicious cycle because
right.
You talk about the isolation from being out of school. And obviously that can contribute to anxiety, depression, and even the prolonging of pain. And then the anxiety and the chronic pain interact and exacerbate each other.
Exactly. It's all a vicious cycle and a feedback loop that we have to break.
Yes. And then you also talk about the role of family dynamics and how that can play a role in supporting or even hindering recovery from chronic pain.
Yes. And actually, I should have mentioned also the medical system. So many kids come in with medical trauma. I forget the average number of doctors that kids usually go to before they see Dr. Zeltzer, who has talked about this. I think it's something like 35. And so they've been dragged around to different doctors. They've been poked and prodded. They've been told, maybe you have this, maybe you have that, try this, try that. But most of all, they've been treated poorly typically. And I'm married to a doctor, so I'm not trying to, say all doctors are bad, but doctors tend to just really not do well with these types of issues. And so they say, like, it's all in your head, just get over it. There's nothing we can do about it. You're just going to have to learn to live with this forever. This is going to be what happens for the rest of your life. I mean, it's pretty bad. And so these kids come in pretty traumatized and also really hopeless and demoralized a lot of the time. And so they don't even sometimes want to try any treatments because they're so sick of it.
Right. And for individuals experiencing chronic pain, for young people, there are treatments. And does the treatment focus on changing how the brain processes pain? What therapies have been found to be effective in dealing with chronic pain?
Yeah. So, I mean, I feel like I've had a really good, level of success. And that's great because that should give parents and kids hope. The brain as you're younger, I think it's more plastic. And so, you can, I think, recover easier than when an adult comes in with chronic pain. But it really is a team approach. It has to be, there's all these pieces of the puzzle. It's really complex, much more complex than acute pain. Acute pain is nothing compared to the complexity of chronic pain. So you have to take all these pieces of the puzzle and try to figure out how to fit them together over time. And the way that I look at it, the way I kind of approach it is, first of all, psychotherapy. I know I'm a therapist, so I'm biased, but I do think it's really important because you want to address the root causes of these stressors and the function of the pain. Is it helping avoid bullying in school? Not that they're faking it to get out of school. I don't mean that at all. But is it helping them avoid the social problems at school? You need to treat the comorbid mental health issues like anxiety or OCD or depression. You have to have a therapist help you or a behaviorist with the behavioral changes that are necessary. We have to get them back into the world. And that takes a lot of behavioral changes. And then we have to help them express negative feelings that they've always kept inside. So I would say psychotherapy is definitely one aspect of treatment. Another can be medication, whether that's for the mental health issues and for the pain. And then they have to try different other modalities to see what they connect with. So, we call them complementary alternative medicine, things that aren't just medication. And what I like to use as a guideline is to do something that's active that you're learning, like physical therapy or biofeedback, where you're actively participating in it. And then something that is to help calm your nervous system that you're not necessarily participating in. You can be like a passive recipient of, like cranial sacral massage or Reiki or acupuncture or hypnotherapy or guided imagery, you are participating, or learning mindfulness, you are participating. But, things that kind of calm the nervous system down, because the nervous system is really activated and on high alert. So we want to do that. And then whatever we do, we want to make sure when we help them get back into the world and functioning, we want to do it slowly. We want to pace the recovery. We want to help them kind of with a rehabilitation model. So let's say we're helping them get back to school. We might, if they have friends at school, we might just start with lunch. Just go for lunch and hang out with your friends, and then maybe just go for one period, like an elective that you really like. So we want to go slowly and pace things, both for physical reasons and emotional reasons. The main thing is that we have to drill it into them that they have to function first before the pain goes away. And that is the absolute opposite to acute pain. With acute pain, you're just like, coddling your limb, you're not using it. And when it's healed, you're going back to things. The really difficult part of chronic pain and the really upsetting part to the patient is that You have to be functioning before the pain goes away. The pain going away is the last part. We get you back into the world, and then the pain starts to recede into the background of your consciousness instead of the foreground and eventually go away. But it goes away once you're immersed back into socializing. So that's one of the other big treatment goals is get the friend over even for a half hour to watch a video together, or start by FaceTiming a friend and getting back in the loop. So getting them back to socializing, improving sleep, tools for improving sleep, getting immersed in something creative that distracts them, that is mindful. I work with an organization, Creative Healing for Youth in Pain. And so we talk a lot about doing creative activities, and creative, we're very broad. This might also include gardening or baking. It can be anything that immerses you so that those pain signals have a chance to have a break for a little while. Because often when you're doing that activity, you don't notice your pain. So it gives the pain signaling a break. And there's all sorts of differences between the way that your parent needs to treat you. And this is part of what I do is I work with parents on so many ways that they need to interact with their child differently if they have chronic pain versus acute pain. So, just one quick example, there's, hundreds of them, but one is not asking about the pain because we don't want to focus on it. If they have acute pain, you might be like, how's your tummy feeling today? You still have a fever? Or are getting over your flu or something? But in chronic pain, you don't ask about it because you don't want to put the focus on it and draw their attention to it.
Right. You're really breaking the cycle of the fixation on the pain when you do that. And you also talk about a concept of backward parenting. What is that and how does that impact the recovery process?
So with backward parenting, so that's an example of not asking about the pain. By backward parenting, what I mean is you're parenting completely differently than you ever thought you would, either with acute pain or just in general. So an example would be, let's say you're a parent who, if your child didn't go to school that day, they're not going to be allowed to go to their after school activity or see a friend, right? Well, if you're not well enough to go to school, then you're definitely not well enough to go play with your friend. No, we do it absolutely backwards of that in chronic pain, because if they're up to doing anything, especially seeing a friend, yes, go see the friend. It doesn't matter that you were into school today, because guess what? You're more likely to go to school if you've connected with your friends. So that would be an example of backwards parenting. Not asking about the pain is an example, or um, pushing your kid to do something when they're not feeling well. Normally, a nice parent would be like, oh, I'm sorry, you don't feel well. Of course, don't, do X, Y, or Z. With backwards parenting, we have to teach the parents to say, hey, this is something you need to do even though you're in pain. Or another really important backwards parenting, probably the most important one that I ever teach parents, is let's say your child does do something that they haven't been doing, like, oh my gosh, they actually stayed for 2 periods at school instead of 1. Like they elected to stay for an extra period. When you pick them up, if you're doing normal parenting, you would say something like, oh my gosh, I'm so glad you feel better enough to stay for 2 periods. That's amazing. But in chronic pain, this is a huge no-no and will lead to your child not going to school the next day, because they think that you think that they're all better if they can stay for 2 periods. And they need you to know that they're not all better. They just push themselves. So the parent has to say something like, wow, I'm so impressed that you stayed for second period, even though you still don't feel well. You have to always be acknowledging that they're not well until months after they're completely better. You have to really make sure it's all better, because these kids have a lot of fears of getting better. There's a lot of fear there, and that's one of the jobs of the therapist is I'm always looking and asking directly, to my clients, what are you scared about getting better? If I waved a magic wand right now and took everything away, all your symptoms, what would you hesitate about? What would make you not so sure you want to be better? And, these answers can range from, I'm scared to go back to my activity that I used to be the star at, and I'm not going to be the star anymore. Or what are people going to expect about me? Or I'm scared to go back because I don't really have any friends at school. Or I'm scared because I've been having a lot of time with my mom that I don't normally get because she took off of work to be with me, and I'm scared I'm going to have no attention again. It can be all sorts of things. And so one of the things I work with the parents is really slowly. Part of the pacing is with the parents of not having a lot of expectations. Because what parents are so relieved when their kids start to feel better that it's like, oh, wow, now you can do this and now you can do that. And now you can go back to this. And now and I say like, whoa, hold on. You're going to scare your child off, and the pain signals are going to start again because they're going to be stressed. So one thing at a time, no expectations all at once, just very slowly building back. And I have kids say to me sometimes, I played soccer. My parents were really invested in it. I was really good and they were really excited by it, but I don't want to play soccer anymore. And so I don't know how to tell them because they're going to be devastated. So I have to work with the parents on their expectations and letting their child really drive what they want to do.
Right. And so the treatment approach really has to involve the whole family.
Yes.
It has to involve the student experiencing chronic pain, and the parents need coaching on how to address it. And one of the things that you mentioned was, encouraging reintegration into daily activities. And I'm thinking about the kids who've been out of school for some time, and you're reintroducing them to school, and that obviously is done slowly. Are there specific accommodations that are particularly helpful for students with chronic pain to ensure that they participate and succeed?
Yes, absolutely. So there are 504 plans, which are other health impaired, and there are IEPs, individual educational plans. And so, and private schools, parochial schools, and public schools have different types of things, but basically, what you want to advocate for depends on, of course, what your child is dealing with. But it is things like extra time on tests because of not only anxiety or executive functioning issues, but also some of the fatigue and brain fog that can come with chronic pain. So also extra time on deadlines. So if the child needs an extra day because they're having a flare or they're really exhausted one day, that they can turn in an assignment late. Sometimes it's important to have different ways of assessing the child. So let's say their wrist is really bad, really painful, so it's hard to write. So maybe they have to take something orally. A lot of times what we do is we have the teachers just give the very essential work to these kids. So they'll pare down all the busy work and just say, just write these 2 essays and then that's enough. You don't have to do these spelling sheets or, whatever, so that they can not have so much work. Sometimes they will be on a modified school day. So I usually tell the school that they can't come first period because most kids with pain have trouble in the morning and it's hard to get up. So maybe they'll start second period, and often they'll have a short day. So maybe they go to class for 2 periods. Let's say something like a language or a lab science, it's harder to do at home. And then the other classes, they just do the work at home, whether it's just getting the work from the teacher, or maybe there's often there are online courses that the school will approve and give them credit for. So there's that. There is home hospital where you don't go to school and the teacher comes to you, but I am not a big advocate of that because I want the kids to not be so isolated. But sometimes that's the first step. And a little secret I'll say, which the school educators will be very mad if they hear me say this, but the schools will always tell the patients that they have to be enrolled only in home hospital or in their school, that they can't be dual enrolled. But when I get involved and I advocate, I always get them to bend the rule so I know it can be bent, where maybe they're at school a couple periods a day and then they have other classes with home hospital, or they go to school 3 times a week and they have a teacher come out to help them twice a week or something like that, where it's a modified schedule. So there's that. There's being able to leave the classroom when needed. So let's say they have an overactive bladder, where they get bladder spasms and they need to run to the bathroom because they don't know if it's a false alarm or a real alarm, and that they don't want to raise their hand and say, "Can I go to the bathroom every time?" So there's that. Or they can get up and go in the hallway and stretch for a minute because their back hurts to sit for 50 minutes straight. So some of those physical accommodations. Sometimes when they're younger kids, I'll have them put something on their desk, like a red on one side, like it'll be like a little signal to the teacher, like a little red cube or something that says like, "I'm not feeling well," and they'll put their head down on the desk and the teacher will know, just leave them, it's okay. So there's all sorts of things, but it's very individualized.
Yes. And all helpful to keeping the student in the classroom, for as long as possible, and then building their tolerance through the pain. For parents and caregivers who are feeling overwhelmed, because I can imagine it's difficult for all the reasons you said, it impacts the whole family. Many times, family members can't do things. They can't do things together. They can't go out, and they feel overwhelmed. Do you have any advice for the caregivers to help them support their child while maintaining their own well-being, which is critical as well?
Sure. It's really hard for the caregivers and, can lead to marital issues, or if they're a single parent, they're overwhelmed with work and taking care of this child and having to stay home to take care of the child. Siblings get really frustrated, as I said. One thing I always tell parents is, really, if there's a sibling, try to have some special time with that sibling so they don't feel neglected. Parents need their own support, so I usually suggest that they enroll in therapy of their own for support. And then I do lead support groups for parents through CHIP, Creative Healing for Youth in Pain. So we have free online Zoom support groups where where parents can really feel at ease and at home talking to other parents who are going through this, because they feel so isolated. And in my groups, we talk a lot about self-care. So doing things throughout the day, even if they don't have time to go take a 20-minute walk, they may take 1 minute a few times a day to do some deep breathing, to do some stretching. I teach mindfulness exercises that they can do in 1 minute throughout the day. So doing things to take care of themselves, keeping in touch with family and friends, even if it can only be on the phone. Parents end up getting isolated from their family and friends because they're so busy with their child, but also their family and friends often don't understand and kind of ice them out. And so I try to help the parents understand some language they can use to explain the pain. Same with the children. I give them ways that they can explain what's going on to the kids who accuse them of faking at school. But the parents really, they need to have the time to take care of themselves. Sometimes if there's 2 parents in the home, it suggests like one parent go away overnight every once in a while and let the other parent take over. So anything they can do and the parents, I also talk to the parents about engaging in their own creative healing. So, getting out to the garden if they can, or, going back to an instrument they haven't played and just getting some healing that way too.
Right. And if there are individuals listening to this podcast who want to learn more about how to support their child, their teen with chronic pain, they need support themselves, what is the best way for them to connect with you?
Well, first of all, they can go to the CHIP website. I think it's www.mychip.org. And there are a lot of resources there. There are webinars that have been recorded. They can also see these webinars if they go to YouTube and then type in the whole name, Creative Healing for Youth in Pain. They'll see a lot of webinars where we go over these types of things. And so there's that. On the CHIP website, there are book resources and support group resources for parents and for the teens, because there's also groups for the teens. So they can find a lot of resources there, and they can get me through the admin at CHIP. They can find me.
Wonderful. And I will be sure to put all of those resources in the show notes. Dr. Levy, I cannot thank you enough for sharing your expertise and all of this great information, really shedding light on, the complexities of chronic pain, but helping us to better understand it, how it presents in children and adolescents, and how to provide support. So thank you again for being here.
You are welcome. And I hope that this helps people out there dealing with this.
I know that it will. Thank you again.
Take care.
Thank you so much for joining me today. I appreciate your time and hope this episode helps you to better understand chronic pain and encourages you to approach it with greater understanding and hope. Don't forget to subscribe to the podcast for more insightful conversations on how we can better support children and families. Thanks again for listening. Until next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.